Oops. Thank you. Yes, that would have been awful. Can you hear me now? I hope so. Okay, good, good, good. And if you look at the ethmoid bone here, it's not a very pretty looking bone, okay? Some of the views you do have. I think you have the lateral view of the ethmoid bone in your atlas, and I think you have the posterior view. I do not know what, 16. Oh, it's an inferior view, okay. All right, so you have the lateral and the inferior view, okay. Well, you've got the posterior view here and the superior. We'll see it from a couple different angles here. All right, but this is if we are looking down. So it's basically this view here, and we've cut the frontal bone away, and this is the ethmoid bone underneath. All right, so pretty much this part is what you can see when the frontal bone's in place. So the frontal bone will cover all this other part of the ethmoid over here. Okay? So what this arrow is pointing to are all those little holes, those nooks and crannies, the olfactory foramina, all right, which is part of the cribriform plate, and that is where the olfactory nerves emerge from. Okay? So here you can see on our model here, all right, the ethmoid bone is going to be here. All right, at the center is this structure right here, this little bony projection. It's called the crista galli. And then surrounding it all around is the cribriform plate. The cribriform plate is what's going to have all those small holes in it, the olfactory foramina there. All right. This one here is just a different model, but kind of the same type of scenario here. The cribriform plate is surrounding our crooked crista galli. So this is, you should have this view in your atlas, yes? The lateral view. All right, it's a lot different. Like this is the lateral view, and then if we'll go back to this slide here, a lot different from our posterior view, and then our, the superior view and the posterior view. So our lateral view is, if we were looking at it this way. So you can see the crista galli on the side there. All right, and when that's in the skull, we get this piece of connective tissue. Okay, it's called the dural septa, and it attaches right onto that. The dural septa helps to divide the hemispheres of the brain. Here's the lateral view and the inferior view. Okay. So this projection right here in the center, that's the perpendicular plate of the ethmoid bone, which is one of two bones that makes up the bony nasal septum. And then on either side of that, all right, we saw the inferior nasal concha before, right? But just above the inferior nasal concha is the middle nasal concha. For the middle nasal concha? No, you don't. You do have to say perpendicular plate of the ethmoid bone. Yes, ma'am. Okay, so this again, this is the inferior view. So we're looking up from your feet, up into your skull. Okay. Now you can see those same structures now if we're looking at the anterior view of the skull, right? And you can see, right, your perpendicular plate pretty much ends right here. And this bone right there, that's the vomer. That's the other bone that makes up the bony nasal septum. So here's your middle nasal concha. This right here is your inferior nasal concha. Does anyone remember the name of this structure? Yep, it's above the orbit, so we got to give it a name to tell us where it is above the orbit. Supraorbital, and it's a rounded hole. Close. You got the foramen part. It's the supraorbital foramen. Supraorbital foramen. This is the supraorbital notch here, and you have a supraorbital notch here. What bone is this right here? Makes up your front, yeah, it's your frontal. Yep. What are these two bones here on the bridge of your nose? Good, Brianna, nice. That's right. These two bones here, think bridge of your nose, nasal. The nasal bones. How about this bone here? Goes here, makes up the upper part of your jaw. Yep, maxilla or maxillary bones. Good. What is this structure here called? This crack-like structure. That's going to be your superior orbital fissure. F-I-S-S-U-R-E. Fissure. All right. All right, let's get into the facial bones here. Okay. Now, some of these facial bones are paired bones. So when you see the name of the bone and it's got a 2 after it, that means it's a paired bone. It means it's a left and a right. You don't have to say left or right. You don't have to say left nasal bone or a right nasal bone. I'm not requiring you to do that. Okay? So if there's a 1 after it, it's an unpaired bone. Okay? So these, what are these bones right here? We just said it. What was it? What are those? Nasal bones, right? Right on, right on. All right, so we're going to talk about the zygomatic bone here. Okay, so I'm going to do some labeling with this, okay, and then we're going to actually go and review some of this with the actual slide presentation, okay. All right, so here's the zygomatic bone, all right, part of your cheek, okay, in addition to the maxillary bone. Here's a couple of the views here that you can see of the zygomatic bone. Here's the lateral view, okay, this is the inferior view, and then our frontal view. Okay, what? Just trying to think if I can ask you. Okay, so we know this is the frontal bone here. What's this bone back here? On the back of your head. I heard you. Is it occipital? Yeah. Okay. All right. And then what's this? You guys remember what this big hole is in the base of your skull? If you're not sure and you see a hole in the skull, think foramen. Automatically, foramen. If you're not sure. Okay, and a foramen has to be a kind of a rounded. Yeah, that's the foramen magnum. Okay, the foramen magnum. So again, for it to be a foramen, it's going to be kind of rounded. All right, if it's going to be like here, the superior orbital fissure is like a crack. Okay, it's going to be oblong. If you're not sure, go with foramen if it looks like that. Okay, so here's the zygomatic bone. Okay. And it's got 3 processes to it. Remember what a process is, right? It's a bony projection that comes off of the bone. Okay? So here we can see those 3 bony projections. We've already seen one of them. All right? That's this guy down here. All right? The temporal process of the zygomatic bone. That's one of the bones that helps to make the zygomatic arch. Remember that bone that runs back towards the ear there, or that, the anatomical structure that runs back towards the ear? So how I remember, all right, which is which, all right, the maxillary process is this big fat, it's thick. All right, that's the maxillary. And then the frontal is the long but thin. All right, it's thin. It's a long, thin process. That's the frontal process. Okay, that should be in the atlas, right? Is the zygomatic bone in the atlas? What page? Do y'all know? 16? Okay. And then this one right here, the temporal process, that's like the medium one. All right, now what I'm going to do is I'm just going to rotate this so it's in the correct anatomical position. Okay, so this is, we're looking at the left zygomatic bone. Okay, so if you look right here, see this part of the bone that's nice and smooth and rounded. Okay, let's go to the skull. That's this part. That rounded, smooth portion is this part right here. Here's the I'm going to outline the zygomatic bone for you, right there. Okay, so the zygomatic bone makes up the kind of part of the lateral margin of your orbit. All right, that's going to be, see how that's nice and smooth there? And then when we get down to these processes, these are jagged. That's jagged. You know, that's rough and jagged. That's rough and jagged. But we have this nice smooth area. That is the lateral, all right, margin of your orbit. We'll stick it back in the anatomical position. Okay. So the big thick one, that's the maxillary process. So that's going to wrap around the front towards the nose. All right. This process here, the frontal process, is going to go up towards your forehead. All right. And then our temporal process is going to wrap back down, not down, but back towards the ear. Okay. And that temporal process is going to make your zygomatic arch. Okay. Part of the lateral portion of your cheek. So now, on this next slide here, I'm just going to take the bone and stick it on the skull so you can see how all these processes fit in there. Okay? So here's the joint space between the temporal bone and the zygomatic bone. Here's the joint between the frontal bone and the zygomatic bone. And here is the joint between the maxillary process and the maxilla and the zygomatic bone. All right, but again, you can see this nice, smooth lateral margin here of the orbit, which is in between the frontal process and the maxillary process. And keep in mind, remember, we named the process after the bone that the zygomatic bone is going to articulate with. Okay? We wouldn't call it the zygomatic process, it's the zygomatic bone. We call it the frontal process. So we know, all right, it's articulating with the frontal bone. So while you folks are copying some of that down, I'm putting an X here. What bone is this? Begins with a P, parietal bone. How about this bone here where your ear sits on top of? This one. What bone is that? Kind of outline it here. That's the temporal. That's right, Laney. Nice job. Okay. How about this one? This one's a tough one. You can see just a little bit of it. What's this bone right here? That's the sphenoid bone. Okay, the sphenoid bone. All right. I'm sorry? In the title for those? Because it's just, it's telling you, all right, well, when they say process of, one, they want you to tell the name of whatever bone it's coming off of. So again, just the whole purpose of the process is a bony projection that's going to, I won't say in most cases, but in this case here, it's going to articulate with another bone. So they want you to name the bone and also the process, which is what bone that process is articulating with. So you can see here again the zygomatic arch, right? And then it's telling us the two processes that are making up the zygomatic arch. All right, temporal process of the zygomatic bone, the zygomatic process of the temporal bone. All right, and another paired facial bone is the lacrimal bone. All right, the lacrimal bone is going to sit just posterior, right, to the maxilla. So we can see here, here are the nasal bones, here and here. Here's the maxillary or the maxilla. All right, this little part of it comes down here. And then just behind it, all right, that's the lacrimal bone. All right, I'll show you on yours. It's hard to see, especially on these models here, but you just have to, it's in there. It's like Prego, it's in there. Okay? Oh, here, let me use this. I like the colored skulls here. It's always easier. Usually when I do the lab exams, I like to use the colored skulls to really depict the bones, only because it's easier to do that on a test. So you can see here, all right, here's our frontal bone. Here's the maxillary bone, or the maxilla. Okay, here's the lacrimal. Here's our two nasal. And then you can see this red bone back here. That's the sphenoid bone. So it makes up part of the posterior margin, not margin, but wall of the orbit, and then you can kind of see it here on the side. Along here's the zygomatic, here's the temporal bone, and you can see a little bit of the parietal bone right here. All right. Another bone, facial bone, is the vomer. Here are the three views that you can see it from. Okay, the anterior view. All right, then we got the inferior view, and then you can see it here on the sagittal view. This is the perpendicular plate of the ethmoid bone. So here you can see it here. Okay. And then you can also see it, and we've seen it in this view plenty of times. Ooh, okay. What's this right here? We just learned about it about 10 minutes ago. That's the middle nasal concha, right? Middle nasal concha, inferior nasal concha. All right, perpendicular plate of the ethmoid bone right here. All right, now here is the vomer from the inferior view. It's right here. Okay. Right, another facial bone is the inferior nasal concha here, and we can see it right there. All right, and then you can see, we've seen all these structures. Here's the perpendicular plate of the ethmoid bone. Below it's the vomer. Both of those make up the bony nasal septum. All right, then you have your inferior nasal concha, and just above it is the middle nasal concha. And here you can see it on a nice CT scan here. Or this, no, I'm sorry, take that back. It's an MRI. Okay, so you can see here's the inferior nasal conchas, the middle nasal concha, and you go way up here. It's tough to see, but up here is the superior nasal concha. And then right here is going to be the bony nasal septum. So we can see, there you go. Here's everything in place for you. You have all that labeled? Good. Okay. All right. Palatine bones. By themselves, they look really weird. Okay. This is the picture of the palatine bones. All right. But in your skull, okay, they are paired bones. You have a left and a right. The palatine bones make up the posterior 1/3 of the what we call the hard palate, or the roof of your mouth. Okay? So here you can see it, and I think this is in your book. I don't know what page that's on. 17 or 16? Was it 15? It is on 16? Okay. Okay, 16. Thank you. Okay. So this part right here, and again, and I'll show you where we will find this, okay? But this kind of flattened portion right here, that's the horizontal plate of the palatine bone. So when we go back to the inferior view of our skull here, okay, you can see it. There's the suture line, okay? That is the horizontal plate of the palatine bone, which is the posterior 1/3 of the roof of your mouth, and the posterior 1/3 of the hard palate. All right, and then I'll just show you on this model. I know you don't have this in your book, but here you can see it. You can tell the difference. Much easier to see the maxillary bone separate from the horizontal plate there. Well, speaking of the maxilla, that's the next bone that we're going to talk about. Oh, wait a minute. What's this structure here? Yep. Or foramen magnum. Here's the occipital bone, right? Okay, and then these brown bones on either side, these are the temporal bones. Temporal bones. All right, here's the maxilla. Okay, anterior view. You can see makes up the upper portion of your jaw, okay? And then you have a little bit of the bone that goes all the way up on the lateral portion of the nasal cavity on either side. All right, you have both the nasal bones in between the maxilla at the bridge of the nose there. And the maxilla also makes up, all right, a part of the floor of the orbit here. So you have two holes, here and here. Okay? Those are the infraorbital foramina. We'll hit those in a second. So here's our our anterior view. Okay? A couple views of the maxilla here. Lateral view, okay? And then the inferior view. Okay, so we're going to start labeling some parts of the maxilla here. All right. Alveolar processes are basically these bumps and ridges that are from where your teeth insert into the maxilla, okay? So there are these grooves, and you can feel them, all right, pretty much where your gums are, all right, along the jaw, your mandible, and the maxilla. You have them up and down. So you have to label these the alveolar process of the maxilla because you have an alveolar process of the mandible. You have to be specific. You got to tell me which bone. Okay? So these are for your upper teeth. So that's going to be the alveolar process of the maxilla. I'll show you on this model here. Okay? You can see it a little bit better because you can see you have these grooves, these bumps and depressions here. And that's the alveolar process there. And then let me show you here from the anterior view. Here you can see them much better. You can also see a hole underneath each of the orbits. All right, so we have a supraorbital foramen in our frontal bones. Now we have an infraorbital foramen in the maxilla. Okay, here and here. What bone is this right here? Yep, that's zygomatic. Good. Okay, so we're going to switch over now to the inferior view and show you the maxillary bone. Pretty much the maxillary bone is the part that's being circled or what's above that blue line that I just drew. Okay? Because this, below the blue line, that's the horizontal plate, right, of the palatine bones. Okay? So this next slide is going to show us, there's that suture line there. So pretty much this region here of the maxilla, all right, that's the palatine process. So kind of like what we saw with the temporal bone, all right, that part of the temporal bone that articulated with the zygomatic bone, we call that the zygomatic process because it was articulating with the zygomatic bone. Well, this part that I just circled of the maxilla, all right, is called the palatine process of the maxillary bone. Okay?
I'm sorry, so the line is the horizontal plate of the palatine bone?
Well, the line I'm just showing you is the joint line between the maxillary bone and the palatine bone. So this is the palatine bone here, specifically the horizontal plate of the palatine bone. Okay? And then this, so basically, when I first draw the line in, everything above the blue line is the maxillary bone, everything below the blue line is the palatine bone. Now, if we want to get specific, where this arrow is pointing to, all right, where I'm circling, that is the palatine process of the maxillary bone. In this area that I'm circling, the flat portion of the palatine bone here that makes up the posterior 1/3 of your hard palate, that's the horizontal plate of the palatine bone. So you can see all three on this slide. I just like to draw the line in there so you can kind of see where the maxillary bone ends and where the palatine bone begins. Or I could just use this slide. You don't have it, unfortunately, in the book, but it definitely shows you the color differentiation. The red is the palatine bone. The purple is the maxillary bone. All right, let's go to another unpaired bone of the skull, and that's going to be the mandible. Okay. Here's our lateral view, and then this is the sagittal view. You can see on the inside, and then the anterior view here. Okay. We're going to just go through. Here's you have this. I don't know what page is this on. 16. There's a lot of stuff on 16. All right. So let's go through. All right, a couple of the structures that we're going to see here on the mandible. All right, 3 structures right away. All right, on the upper portion of your jaw here. All right, this part here is what makes up your temporal mandibular joint. So we call that the condylar process of the mandible. And then you've got this kind of shark fin shaped structure over here. That's the coronoid process of the mandible. Folks, this is the first time that you're going to see this name here. You're going to see it a couple more times, which can be somewhat confusing. All right? But make sure that you know how to spell it, and make sure you know that you need to say of the mandible. So it has 3 O's in it, C-O-R-O-N-O-I-D, coronoid process of the mandible. So between these 2 processes, we have this dip, and that's the mandibular notch. Because there's a couple other structures that are very similar in spelling to the coronoid process. There's the conoid, all right, tubercle, and then there's also the coracoid process. So that's why spelling, it can be confusing. So you need to make sure that your spelling is precise. Okay? And there's another structure, all right, in the upper extremity called the coronoid process. We'll see that. Okay? All right. All right, so this portion of your mandible, pretty much the vertical part of the mandible here, that whole stretch, that's the ramus. Okay, that's the vertical portion. Then you've got the body, which is pretty much this horizontal part. Okay, that goes from here to here. That is the body. So you get the ramus, the vertical part. The body of the mandible is the horizontal part. And then on our mandible, you also have the alveolar processes. Okay, those are those ridges. This is not the best example. I'll show you a better example here in a second. Okay? And then you got a hole right here, small rounded hole. Okay? And we call that the mental foramen. So you got a lot going on in this picture. All right, so this slide here, this is the body pretty much goes from the center all the way back, all right, to the ramus there. That's the body of the mandible. All right, and then you can see this is, I think this is a little bit better depiction of the alveolar processes. Bumpy ridge-like structures, and then of course you got a mental foramen there, and you also have one over here. Okay, you got one on each side. And then you've got one foramen on the inside of the mandible. Okay, now the picture in your book, in your atlas, is not very good. So this is what I tell students. Just draw a black dot or a dot somewhere in that area there. Okay, I'll show you. This is what yours looks like. See, there's nothing there. So I tell folks, just draw a black dot in this vicinity. This is the only structure on the inside of the mandible that you have to know anyways. Okay, so that's called, it's the mandibular foramen. Your infraalveolar nerve travels in there. That's the nerve that the dentist sticks the Novocaine into when you're getting your teeth drilled on. Okay. Okay, let's talk about a couple of the sutures here. Okay, what's a suture? It's a joint. It is one of the most non-mobile or immobile joints of the body. And that means that it's one, movement and stability have what we call an inverse relationship, like pH and hydrogen ion concentration in chapter 2, remember? The higher the hydrogen ion concentration was in a solution, the lower the pH was. Remember, the lower the pH, the more acidic something is. The higher the pH, the more basic something is. So with stability and mobility, the more mobile a joint is, like your shoulder joint, the less stable it is. More prone to dislocation. Okay, but the more stable a joint is, all right, the less mobile. So these are virtually immovable, which means they've got a lot of stability, which makes sense. Is it easy for you to push on your skull and you don't feel your bones really moving around? I hope not. All right. So in these suture spaces, they are connected by that dense regular connective tissue. Well, what else is dense regular connective tissue? What other tissues? Remember? Ligaments, tendons, those are pretty strong, right? All right, ligaments and tendons are very strong. So the dense regular connective tissue in those suture joints is pretty strong. So it creates this interlocking mechanism here. So it helps to make those joints stable as heck. Okay? So there's several around, and we're going to name them. Okay? So let's start off here. Okay, we've got the coronal suture, and this is the suture that is going to be found in between your frontal bone and your two parietal bones. Okay? And then on the way back, you have the lambdoid suture. Lambda is triangle. Okay? And it is going to separate, all right, your two parietal bones from your occipital bone. So let's take a look. We're going to look at the sutures here. I'm going to start off with the coronal suture. Okay? So you can see the coronal suture from a couple different views here. Here's the lateral view. All right? This is the anterior view, and then our superior view. So here's the frontal bone, and then our two parietal bones. So I'll show you what it looks like in your atlas. There's the coronal suture. Okay? Coronal is going to separate the frontal bone there from the two parietal bones posterior to it. Page. Does anyone have a page on that one? 14. 14. 1 4. 13. Sorry, 1 3. Lucky number 13. Okay, so that's the coronal suture. The other suture I was talking about is the lambdoid suture. You can kind of see, all right, we've got this kind of triangular-like appearance to it. All right, it's going to separate our occipital bone here from the two parietal bones here. So you can see it from the lateral view. Here's part of the lambdoid suture. Here it is from the superior view. I'll show you in your book. Okay? That red line is representing that lambdoid suture there. Then I'll make it disappear. There you go. All right, a couple more sutures. We have our sagittal suture and the squamous suture. The sagittal suture is easy because it runs in between your left and right parietal bones. It's going to separate those. And it runs from the coronal suture anteriorly, all right, posteriorly back towards the lambdoid suture. And then on the side of your skull, you got your squamous suture, and that's going to divide, that's going to be found in between the temporal bone and the parietal bone. And we'll see that on both sides. And then we talked about the phenomena of the sutural bones. all right? And those are these small little bones that you'll see sitting inside of some of these sutures, okay? And so we'll see it. I've seen it one time in a suture other than the lambdoid suture, but you will most often see it in the lambdoid suture. All right, so here you can see the squamous suture, the sagittal suture. All right, it's running from the coronal suture here in the front, posteriorly back to the lambdoid suture back here. And it's going to be found in between the left and right parietal bones, right here. Actually, I'll get rid of that red line. All right, so that's the sagittal suture. And then we've got our squamous suture here laterally. All right, here's the temporal bone, here's the parietal bone, here's the squamous suture right in between the temporal and parietal bones here. So we'll show you on the model in your book. And we'll just get rid of that red line. And then here are our sutural bones right there. So over time, our sutures will eventually fuse, okay? And certain sutures will fuse at different times. So obviously when you're much younger, all right, when you're a teenager, and it's because, well, one, you're not done growing completely, but after you reach skeletal maturity, we'll start to see the fusing, all right, of these joints here, or these sutures here. All right, coronal is usually the first to go. Coronal is the first to go. All right, but you can see the squamous suture can take up to 60 plus years, 70 or whatnot. So one of the things that pathologists will do, or forensic scientists will do, is they'll find the remains of somebody, and they'll see, and they can kind of guesstimate the age of that person depending on, there's other ways to do it, but one of the ways they can do it is look to see, all right, if the sutures, all right, have fused. And if they haven't fused, all right, and it depends on which one, it helps them to determine the age of the skeleton. All right. Oh, okay. We're going to revisit these guys in a later date anyways, but the auditory ossicles, all right, these are the bones that you find within the ear, specifically in our petrous portion of the temporal bone, or the petrous part of the temporal bone, okay? And there's 3 of them. You don't have them in your book, all right, but we're going to revisit these when we do chapter 16. But just to kind of give you an idea of the size of, these are the smallest bones in your body, by the way. You probably already knew that. But you can fit all of them, or all 3 of them, pretty handily on a penny, okay? It's really quite impressive. The stapes, I believe, is the smallest bone in the body. That thing's tiny, okay? And they obviously help with listening and hearing. Hyoid bone, one of my favorite facts about it is that this bone does not physically articulate with any other bone in the body. And when we look, I'm going to come right back to this slide. When you look at it, you'll see it commonly at an X-ray. All right, it's going to float between C3, C4. All right, but it's just a site for muscular attachment. You can see here, here's your thyroid cartilage. It sits superior to the thyroid cartilage. And you'll have several muscles that it will attach onto the hyoid bone. All right, but again, muscles for phonication, talking, also some of the muscles for your tongue will connect onto that bone. The only thing you really need to know, you don't need to know all these different parts of the hyoid bone. You just need to be able to identify it. So if you saw that on a lab exam, all right, please don't put mandible. Okay, I had someone put baby jaw, and it looks like, you think, though, I mean, doesn't it, though? And I can understand that. I get it, you know, but that's why I'm going to tell. And sometimes I'm nervous saying that because I don't want to put the idea in anybody's head, but this is the hyoid bone. Okay, that is the hyoid bone. It's going to be probably about 4 inches below your jaw. Okay, or if you can feel out your thyroid cartilage, just go about a ½ inch above it, and that's where it's going to be located. Okay. All right, a couple differences between male and female skulls here. Okay, we'll talk a little bit more about this in lecture. Women's skulls a little bit smaller than men's. Okay, men's skulls will have a little bit more of obviously a bulkier appearance, but we'll have. Remember we were talking about the superciliary arches on Monday, all right, or Tuesday, excuse me. Ours are a little bit more pronounced. Okay. So when we look at, oh wait a minute, okay, I'm jumping ahead. Sorry. Let me come back to this. All right. So I used to say it, but as a joke, and I say a joke, you know, I'd ask my classes, do you know why men's skulls are bigger? Does anyone have any idea? Because our brains are bigger. It's funnier when there's some males in the classroom. No, none of the girls ever laugh at that joke, and that's why. But I use it only because, one, I want to make sure that no one's sleeping and they're paying attention to me. All right. So I say it not to offend. Okay. So let's jump into the last part here, and then we're going to. I think we'll be done with this part. We'll just run through a couple more slide identifications. Today's a lot of slide identification, which is important. Fontanelles. Okay. If you're familiar with the soft spots on the baby's head, all right, then you're familiar with the fontanelles and what they are. And basically, all right, it only makes sense to have these structures, especially during a vaginal delivery of a child, because when the baby's head is passing through the birth canal, there's a lot of overlapping of the cranial bones, which makes sense. All right, one, to make it a little bit easier on the mom, and two, to make it easier on the baby, okay? And these fontanelles help with that, okay? So they allow for some of the flexion and distortion of the skull of the baby as it's passing through the birth canal, all right? But this is, again, another dense connective tissue structure, okay? And so the two major ones that we're going to be seeing are the posterior fontanelle and the anterior fontanelle. All right, the anterior is the bigger of the two, so it closes later on, around 15 months. The posterior fontanelle, all right, is the smaller, so it'll close sooner, so it'll be around 9 months. We have two smaller fontanelles, the mastoid and the sphenoidal, and we'll see those in a second. All right, as soon as the baby's born, there's really no more purpose for having the fontanelle, so they'll start the process of fusing and closing up. But as you can see, that takes a long time, all right? 9 months for the posterior, 15 months for the anterior. Mastoid and sphenoid, quicker, obviously, because they're much smaller, all right? But it can take some time. The reason, a lot of it has to do with the fact that they're made of dense connective tissue. It takes time to get rid of that tissue, all right? It's not an easy process. So here's the first one here. Here's the anterior fontanelle. Now, you can spell it as it's shown here, or you can add an L and an E to it. It's really up to you, okay? Some of those spellings are old school spellings. All right, you can see how it's spelled here. All right, fontanelles this way with 2 L's and an E on the end. All right, and you can spell it this way here with just 1 L. Okay, either or is fine. Okay, so here's the anterior fontanelle. You can see it's quite large. Let's compare it to the posterior fontanelle here on the back. And I know it's the anterior because here I can see the baby's face. Okay, so I'm in the front. Here on this slide, I don't see the face. Okay, so that's the posterior fontanelle. All right, that's the small. You can see, obviously, it's quite a bit smaller than the anterior fontanelle. And then we'll have the two lateral fontanelles. All right, here's the sphenoid fontanelle near the sphenoid bone. And then we have the mastoid fontanelle over here. That's near the mastoid process of the temporal bone. Okay? And look, you can even see the zygomatic arch. Right there. Little small tiny zygomatic arch. All right, and then you can see on this skull here, all right, how the anterior fontanelle is still present, but it's gotten a lot smaller. So this is obviously an older infant here. And then we have this structure here called a metopic suture, And again, this is a suture that hasn't fused completely. Yeah, I can go back to the last slide. That suture, the frontal bone hasn't fused completely, all right? So it's in the process of it. It might take some time or it may never fuse, okay? But in that situation, that metopic suture is present, just showing you it's an incomplete fusion of the frontal bone. You got it. And then here's that picture right there again. All right, here's the anterior fontanelle with our metopic suture down here. Okay, that's all for the lecture, not lecture notes, but of that PowerPoint. I want to run through the other. Let's just run through. We only got, I know, look, 67 slides, but we're going to just run through, make sure we got everything. What's going on? Don't do it, computer. There we go. Phew. Technology, I tell you. All right, so let's run through a couple of these slides here, just to make sure we got everything. Quick review for everybody, okay? So to make sure you got everything labeled, and then we'll get out of here. All right, so here's the maxillary bone, okay? Or you can call it the maxilla. Either or is acceptable. All right, so you'll see here on this bone, all right, you have a hole underneath the eye. Infra, which means below. Infraorbital foramen. Okay? We can see here on our other model there. Infraorbital foramen. All right, onward to the next structure here. The the alveolar processes of the maxillary bone. Doesn't say it on this slide, but it'll show you on the next slide. Those are these nice, all right, ridges and depressions here, found just superior to your teeth. Okay, so that's going to be the alveolar processes of the maxillary bone. Feel pretty good about that? Be able to identify, right? Then we'll see on the lateral view here. Good, good, good. All right, there it is on the lateral view. And then here, this, I think, in my opinion, this is the best view to really see them, just because where the shadows fall on the picture. All right, so that's the alveolar process of the maxillary bone. All right, so now we're going to flip the skull over. We're going to look at the palatine process. I'm not a huge fan of referring to this whole area as the palatine process. All right, I usually refer to this area as the palatine process. Okay? Regardless, though, if it points there, yes, ma'am.
On the test, will it look like that? Is it like that?
Yeah, you won't get that wrong. That's so funny. Brianna said the same thing. So it would look like that on the test. If, I'll tell you this right now, if it was just like this on the test, circled like that, and the arrow's pointing to that, and you say that that's the palatine process of the maxillary bone, you will not get that wrong. Okay, you won't. Right? If it asks, though, what bone is this, and you say it's the palatine process of the maxillary bone, then you will get it wrong, because it only wants the bone. Okay? So just keep that in mind. You won't be wrong if you're specific on that.
So the bone would be the horizontal plate.
The bone, well, the horizontal plate of the palatine, the horizontal plate of the palatine bone is down here.
Right.
Yeah. So again, same thing. If it was just an arrow pointing to that region, all right, of the hard palate, and you wrote on there the horizontal plate of the palatine bone, you're not wrong. But if the question asks, what bone is this, then you would be wrong. You'd have to write palatine bone. Okay? Remember, two bones make up the hard palate. The maxillary bone, right, and the palatine bone. Just that small little area. Well, I'll show you. Yeah, I'll show you here. This one here, you can see it a little better. All right, so where the red is, that's the palatine bone. And where the purple is, that's the maxillary bone. But when we're dealing with the hard palate specifically, okay, this would be this horizontal, this flat portion, all right, the anterior 2/3 would be the palatine process of the maxillary bone, and then this is the horizontal plate of the palatine bone. So always go specific with your answer. All right, if you don't see any words whatsoever, all right, on the test question, be specific. Okay. That's the first thing, and I recommend this every time. Don't be in such a rush. I think you got a minute per question. And some questions you'll knock out in 10 seconds. So look, scan the slide, take you 2 seconds. Make sure there's no words on that slide. All right, you see an arrow pointing to something, don't jump in there yet. Just scan the slide. Do I see any words? Nope, no words. Okay. It just wants me to identify what the arrow is pointing to. All right, next bone. There's the zygomatic bone. Okay. And I'll show you, I'm going to come back to this slide. You can see it. It just stands out a little bit easier here on this colored skull here. All right, there's the zygomatic bone, and here you can see it on the model in your book. So let's look at the bone all by itself, okay? And there's 3 processes that are coming off. So this is the medium-sized process, all right? And so the medium-sized process is the temporal process of the zygomatic bone. Then you have the tall, skinny process, and this is, by the way, the way the bone's positioned on this slide is anatomically correct, okay? So you have the tall, skinny process going up towards the top of our page. That's the frontal process of the zygomatic bone. And then you got that fat, kind of thick process that is going off to the left side of our page, and that is going to be our maxillary process of the zygomatic bone. Correct. Yep, right on. Nice job here. Okay. So then now what we're going to do is we're going to stick that bone right there on the skull. So now we're looking at the right zygomatic bone. And so you can see it in position now. And then we'll take a quick peek here. Then if we're talking about the zygomatic bone, we cannot not talk about the zygomatic arch. And so we now know the 2 processes that make up the zygomatic arch, because I've talked about it like 100 times. The temporal process of the zygomatic bone and the zygomatic process of the temporal bone. Okay? So if you see that oval there and an arrow pointing to the oval, right, that's the zygomatic arch every time. Okay? All right, another facial bone. Take a quick look. We're going to use the colored skull first. That's the lacrimal bone. And so if we're starting from the bridge of the nose here, you can see you have your nasal bones, then you have your maxillary bone, then we go back further posteriorly. That is the lacrimal bone. So we'll see it here on our skull in the book. Okay? From the lateral view, that is the lacrimal bone inside that circle. And I'll show you on this skull too. All right, so we were talking about the palatine bone earlier. Here it is again. All right, that arrow is pointing to the horizontal plate of the palatine bone. So again, if it just says on the question, if there's writing on the question that says what bone, just say palatine bone. You good with that? I just want to make sure I ate it. My mission is for you folks never to lose points in regards to that. Okay, so below that dotted line, that's the horizontal plate. And then you can see it one more time here. Those are the palatine bones. So you can see how the palatine bones, yes, you have the horizontal plate here, but they also come down here, all right, and form part of the nasal cavity laterally here, back that way. All right, let's jump into the mandible. All right, so this shark fin-like structure is the coronoid process of the mandible. 3 O's. C-O-R-O-N-O-I-D, coronoid process of the mandible. All right, then we got that little dip there. That's the mandibular notch. And then posterior to the mandibular notch is going to be the condylar process of the mandible. It is responsible for articulating with the temporal bone and making the temporal mandibular joint. Okay? So then the horizontal, excuse me, not the horizontal, but the vertical portion of our jaw there, that's the ramus. And then our horizontal portion to the jaw, that's going to be the body of the mandible. This little corner here, where they both meet each other, is known as the angle. And this is the mathematical symbol for angle, by the way, in case you wanted to know. Anyone take geometry? Remember that? No? Maybe not? Okay. All right, so that's the body of the mandible. Okay, and then here are alveolar processes of the mandible. Then we can see it from the anterior view in a little bit more detail here. Okay. And then if you notice, you got your little holes here and here, and those are our mental foramen. All right, now we didn't see this in that slideshow that I was showing you earlier. You have these bumps on the bottom of your jaw. Those are the mental protuberances of the mandible. The mental protuberances of the mandible. And it's just a bump there. And then there's the mandibular angle. And then on the inside, there's only one structure that you need to know on the inside, and that's the mandibular foramen. Okay? All right, a few more slides. Nasal bones, paired bones, bridge of the nose, in between the orbits. In the nasal cavity, there's the inferior nasal concha. And then here's the inferior nasal concha on this model. All right, going to the bony nasal septum, the inferior bone, or the posterior inferior bone, I should say, of your bony nasal septum, there's the vomer. And I know in your book, in your atlas, you can see it from this angle, or that view, and you can see it from this view here. So the anterior and the inferior views. And just be familiar with the sagittal view here. This is the bony nasal septum. The posterior superior part of it right here, that's the perpendicular plate of the ethmoid. We'll see that. All right, so here's the vomer here in the anterior view. So just be careful with the arrow placement, all right? Obviously, if it's pointing to the vomer, it's going to be closer to the bottom here of the bony nasal septum. If it wants the perpendicular plate, the arrow will be a little bit higher. It should never really be in the middle there, okay? Which is not fair. Can't tell. All right, here's the vomer on the inferior view. Baby jaw, right? Just kidding. Don't put that. That's the hyoid bone. All right, here are the three bones, the incus, the malleus, and the stapes. You'll see that. We do chapter 16. Okay, let's do the sutures, and then we'll wrap it up. All right. So here is the coronal. Oh, it got cut off. You can put frontal also, all right? So that's the coronal or frontal suture. I don't know why that got cut off. Okay? And then there's the sagittal suture running in posterior from the coronal suture back towards the lambdoid suture. All right? You can do squamous or the squamosal suture if you'd like. Two terms that are acceptable for us. There it is without the line. That's the darndest thing. It's getting cut off on some of these. I'll have to fix that. All right, the lambdoid, or also known as the lambdoidal suture. That's the word that's getting cut off there. It's not even anywhere close to being on there. Correct. Yes, so think of it like this. You'll never have to answer with the bone unless it asks you, okay? It's always going to want you to be as specific as possible. All right, then let's hit the fontanelles. There's the anterior fontanelle. Okay, here's the other one. It's a little bit smaller as it is closing up. Then you can have your posterior, sometimes referred to as the occipital. Either or is fine. And then here's the sphenoid or sphenoidal fontanelle up towards the sphenoid bone. And then finally, the last one, mastoid or mastoidal fontanelle. Okay.
When you're pointing to something like that, is it, I mean, what size of the area is, say, that particular?
How big is the fontanelle? Is that what you're asking? Yeah. Again, it's really tough. And to be honest with you, this skull, the fontanelles have fused. Okay, so they're no longer in existence on the skull. They just didn't have a skull that had an existing fontanelle. They're just showing you that it's in that general area, because that's all bony tissue right there. So it's an approximation. Just unfortunately with the models.
Not just for that one, but others as well.
Well, for these, I mean, these are really easy to see because you can definitely see the actual, the fontanelle. But these other ones, again, these are so small. This one's a little bit better because that is the mastoid one. I'm not really too pleased with. All right, but the sphenoidal, that hasn't completely closed. But the mastoid, that's all osseous tissue there. That's no longer. They're just approximating its position. I hate to say it. You know, but that's it. So you should have, you folks should feel pretty good. And what I mean by that, we've covered all that material. Everything should be labeled in your books as of right now. We've only got one more identification set of slides for the axial skeleton. That's going to be the spine and the ribs. All right, we'll go over that on Monday, okay? And then we'll start the appendicular skeleton on Wednesday.